Infection control. Information to protect healthcare workers on the job from infectious diseases that can be transmitted by blood, body fluids, and human tissue. This information is provided to inform you of our program of Universal Precautions to protect you against bloodborne pathogens, including viruses that cause hepatitis and AIDS. These viruses are passed from person to person by blood or body fluids. 1. The Hepatitis B and C viruses. Hepatitis B and C cause hepatitis or liver disease. 2. The human immunodeficiency virus. This virus is also called HIV. HIV is the cause of AIDS. 3. Cytomegalovirus. This virus is also called CMV. CMV causes an infection which can lead to birth defects. 4. Be aware that blood and bodily fluids and human tissue can carry other infectious diseases as well. 5. If a pregnant woman is infected with a bloodborne pathogen, it may infect the baby. You should know. Hepatitis B is a disease that causes 200 to 300 deaths each year in healthcare workers. A vaccine to protect healthcare workers from hepatitis B is available at your physician's office or local health department. The vaccine is highly recommended for all healthcare providers who have routine or occasional contact with the blood or body fluids of patients. Hepatitis B is passed from person to person by exposure to blood and some body fluids. HIV is passed the same way. HIV has infected some healthcare workers on the job. Most got infected by a sharp injury such as a needle stick. Others got infected with HIV by getting blood splashed on their chapped skin or in their eyes, noses, or mouths. The risk of getting infected while working in the home health setting is low but not zero. For example, the risk of infection by an accidental needle stick with an HIV-contaminated needle is about 3 to 4 chances out of 1,000. However, the risk of coming down with AIDS and dying is high if you get infected with HIV. A healthcare worker infected with a bloodborne pathogen may pass it on to his or her partner by sexual contact. A person who is infected with the Cytomegalovirus, CMV, may not have any signs of illness. This virus may be passed from person to person by exposure to infected saliva and urine. If a pregnant woman becomes infected with CMV, it may cause damage to the fetus, or an unborn child. Often, we do not know that a patient has one of these diseases. Many times a patient does not look sick. However, if you are exposed, you can still get one of these diseases. You can protect yourself from exposure by following special precautions known as Universal Precautions. What is exposure? Significant exposure to blood or body fluids is defined as 1. An injury with a contaminated sharp object, for example, needle sticks or scalpel cuts. 2. Spills or splashes of blood or body fluids into non-intact skin, for example, cuts, hangnails, dermatitis, abrasions, chapped skin, or into a mucous membrane, for example, mouth, nose, eyes. 3. Blood exposure covering a large area of apparently intact skin. Here's a list of examples of exposures. 1. Getting blood or body fluids in cuts or in breaks in your skin, or in skin sores or in large areas of skin. 2. Getting blood or body fluids in your eyes, mouth, or nose. 3. Getting cut or stabbed with any needles or sharp instruments which were used on a patient. 4. Getting cut on the broken glass that was used to hold blood, body fluids, or human tissue, glass tubes, blood collection tubes, bottles, jars, etc. What is not exposure? 1. Handling food trays or furniture. 2. Handling assistive devices or wheelchairs with patients. 3. Using public bathrooms or telephones. 4. Personal contacts with patients such as shaking hands, giving information, touching intact skin as when bathing intact skin or giving a back rub. 5. Doing clerical or administrative duties for a patient.